I'm here again today with Bonny Specker, epidemiologist, who's going to give us an update on what has been happening with COVID-19 in our area, across our state, in the nation, and in the world today, and across the last week. And also, she's going to talk today about where we started and where we are right now in the history of pandemics and outbreaks. So, Bonny, what do you have for us today?
Thanks, Chelsea. I thought it would be interesting to go back to some of the original presentations I did. And I think the first time I heard about COVID or presented anything on it, it was in March of 2020 when I gave a talk to the Altruza meeting. And a couple weeks later, I think I either updated City Council or somebody early in March or early in April. And about like the 1918 influenza and then COVID and what was known. And I thought it would be interesting just go through a couple of those, not a little bit more than a couple of those slides that I originally gave to sort of show where we were back in April of 2020 and where we are now. Especially when it relates to 1918 influenza, because I think there are still a lot of similarities with that and COVID, but I also think there's some differences that would be interesting to highlight. So this was the original slide where I was going to talk about the 1918 influenza outbreak and then also COVID. And before I start, one of the things I wanted to mention was when I taught epidemiology up at SDSU, we always spent one lecture on the 1918 pandemic. And we watched the video that PBS put out about it, and we would have discussions. We even would go to the local cemeteries and record the dates of death, you know, to figure out how many people actually died in that pandemic from Brookings. And one of the things we would always talk about is why didn't people ever hear about it? I mean, even as a graduate student and in epidemiology, we never talked about the 1918 pandemic. And there's some belief that it was so bad that people just put it out of their sort of memory. And I think that that's likely to happen with COVID as well. You know, I'm not sure how much it will be remembered, say 10 years from now, which I think in a way is bad because we need to remember these things so that we're ready for the next one and we can, you know, do what's needed to prevent them from happening again. So this particular talk, I had started out, you know, comparing what happened, you know, just different pictures from the influenza of 1918. And then the original talk I gave to Altruza, a lot of these pictures were from Asia when COVID first came out. But by early April, there were some pictures appearing in US media from, you know, different states. This is the state of Washington. And then we talked about healthcare and how people were being transported to health facilities. That wasn't happening. I couldn't find any pictures in the US in 2020 with that. So I had this one from Wuhan. And then this had just been put together, a treatment site in Philadelphia. This is what it looked like in 1918. So just a lot of the similar type environment. Here we have the sanitation and disinfecting, you know, with New York in 1918 and then South Korea in 2020. And I went into a little bit of the history about the 1918 outbreak, and a couple of the things that are interesting, it did occur in 3 waves. And if you just keep this in mind when we look at the current curves, we're about right here. I'm not sure this part would happen with COVID because of vaccines. You know, you have to remember that in 1918, there were no vaccines for flu. So this is sort of the natural progression of what happens. but about a third of the world's population was infected. There were 50 million deaths worldwide, 675,000 American deaths. And, people were shocked that this could be so high. But right now, we're over 600,000 American deaths with COVID. The thing that's different is that with the 1918 outbreak, it occurred mostly among young adults. So it was that 20 to 39-year age group that had a high death rate. Whereas here with COVID, it's more in the elderly. The fatality rate for influenza in 1918 was about 2%. With COVID in the state of South Dakota right now, it's 1.6. So that's about the same as well. And I had talked about why so many people were infected. It was a new virus, so nobody had prior immunity. That's true for COVID. There were no vaccines, which was true for COVID up until the Moderna and Pfizer vaccines came out. And the control efforts were limited to what's called the non-pharmaceutical interventions. We've all heard about these. These are isolation and quarantining, the good personal hygiene, and limiting public gatherings. These interventions back in 1918 were not always applied, as they were not always applied in the COVID outbreak either. Just a little brief summary here of the history. The life expectancy in 1917 was 54 years for women and 48 years for men. And in 1918, the first two waves of that influenza actually caused the life expectancy to fall by 12 years. Now for COVID, what just recently came out is that the life expectancy has actually dropped by 2 years. So it's less, and that's because, as I mentioned, the influenza occurred in younger people. They have a lot more years of life expectancy left. So if you take them out, it's going to pull down that average life expectancy. Whereas with COVID, the deaths are occurring in the elderly. You take out a chunk of that population, you're not going to have as big of an effect on the average life expectancy. In 1919, the final wave occurred, but this virus, the H1N1, which was the one that caused that influenza outbreak, did circulate yearly for about 38 years. In 1930, they figured out that the flu was caused by a virus. And then after that H1N1 was circulating for a while, a new virus, influenza virus, came, the H2N2, and that started a pandemic in 1957, and it replaced that H1N1 virus. 1960, they recommended annual flu vaccines for high-risk people, and then in 68, there was another flu pandemic, which was the H3N2, and it replaced the H2N2. So every time there's a pandemic, it's a new virus usually, so no one has immunity, so it spreads very quickly. And then here in 2009, the H1N1 came back, and people were really worried about that. It ended up not causing a large number of deaths in South Dakota, because South Dakota did a really good job of getting a large percent of their population vaccinated back in 2009. And this is actually the number of deaths, 24 of them in South Dakota. People were really worried about this as far as deaths, because it was the virus that was related to that 1918 outbreak. So they didn't want a repeat of that. But this slide, this again is back from April or March of 2020. The median number of deaths from flu were 32 at the time with 450 hospitalizations. If you look at the case fatality rate, again, this is about 1.6 for COVID. So it's higher than any of these previous flu years, the average being about 1.3. So then I had mentioned a little bit about these coronaviruses, the ones that cause the common cold. At the time I gave this talk in April, there was a lot of things out there saying this is just the common cold, it's not a big deal. But the thing with these three viruses here is that they affect the lower respiratory tract, which the common cold is really an upper respiratory, not deep in the lungs. And you can see that they occur 2002, we have the original SARS, 10% fatality rate, and it was able to transfer from human to human. That virus was stopped very quickly by identifying the cases and quarantining them. So the spread of that virus was halted and not a lot of people were affected. The MERS or the MERS virus, this one does not have human-to-human transfer. It has a very high death rate, but you have to, I think it's a camel or, it's another animal that like an animal transfers it to a human. And then we have what we're all familiar with now, the SARS-CoV-2. And this is just what the situation was like early in 2020. The SARS had a case fatality rate of 9.6. MERS is 34%. At the time I did this presentation, they were thinking that the case fatality rate for SARS-2 was 2.6%, and this was based on data from China at that time. But this slide was just showing that even though this case fatality rate was lower than the other two coronaviruses, that a lot more deaths were occurring because so many more people were affected. And also it's giving here the WHO back then estimated the case fatality rate to be 3.4%. And now we have found that it's a little bit lower. That could be due to treatment, but it also could be that there's just better data out there. And here was the slide. Everyone was like, whoa, this is like horrible. At this point in time in early April, there were 70,000 deaths worldwide. And, now we're at 3.5 million. But this was, I think, shows how we've gotten kind of numb to it because we thought this was really bad, but now it ended up being so much more than what we originally were seeing. Same here. This is the United States. I was able to, at this time, just start showing the data because, as you can see, there were such few deaths. It wasn't a big deal until towards the end of March, where the beginning of April, we end up with about 9,500 deaths, and now we're sitting at over 600,000. And I mean, originally, people were saying, well, you shouldn't include the deaths on the ship. If you remember, there was that Diamond Princess ship that had an outbreak. Now thinking about it, that's such an insignificant number. Like, who really cares whether you add them to the number or not? It's like insignificant. Which brings us to sort of a milestone, I think, that happened this week, if you want to call it a milestone. South Dakota did reach over 2,000 deaths this past week. And I always give the case fatality rate in the weekly slides, but I never really say how many deaths there are by age. And I thought that it would be good to show that because I think a lot of people think that only elderly people die. And it is true that 50% of the deaths have been in individuals or people 80 years of age or older. But we also have deaths in these younger ages that have occurred. And I think people just need to be aware of that. It's not limited to just the elderly. Deaths are occurring at all ages above 20. And yes, they're smaller, but this is still 2,000 families that have been affected. And I think we need to remember that. So that is sort of a little bit of what I had given almost 15 months ago, and a lot's changed in 15 months.
It really has. It's hard to believe that it has been that long, but at the same time, it almost feels like it's been even longer than 15 months. And I remember that first presentation that you gave at the city council meeting to talk about that flu, the 1918 flu. I learned so much because I had never really heard about it before. And it's interesting to hear that, when you were, first getting started and going to school, that it's not something that you really talked about either. So I think it is important that, we do learn from this, and that we remember. And if anything, I mean, especially for people that have lost someone, they'll never forget. And it's going to be important to honor the memory of those individuals that are gone because of this. So thank you so much for sharing that information, Bonnie.
You're welcome. So here's what's happening this week. Things are actually looking really good. This is Brookings, and we're still in moderate spread, and we're having a hard time getting down to minimal, but maybe next week we'll be there. We have to have less than 10 cases per week for 2 weeks in a row in order to get down to minimal. And this past week, we were in minimal, but DOH uses 2 weeks worth of data to define it. So they still have us in moderate spread, but you can see it's quite low relative to what it's been in the past. So 8 cases this past week compared to 11 the week before. If you look at the hospitalization data, we had 1 hospitalization the past week compared to 2 the week before. This is kind of just bouncing around and not staying down. I think it would be nice to keep it permanently down. The one thing that has stayed down for quite a while are the deaths. We had, again, no deaths. I think it's been, I can't remember how long, but it's been a long time since we have had any deaths, which is good. As far as South Dakota, we're also continuing to drop. 249 cases this past week compared to 325 the week before. You can see that we've had quite a consistent drop over the last month and a half, 2 months. Hospitalizations, we have 48 people were hospitalized as of yesterday, 13 of them in the ICU. Last week there were 53 hospitalized with 19 in the ICU. As far as hospital admissions, these purple lines, 42 this past week compared to 54 the week before. So a lot further down. And if you look back to November, we were at over 500 hospitalizations in a week. So it's a lot better now. As far as deaths, this past week we've had 8 of them or 10 of them in the state compared to 6 the week before. So this again isn't as low. It's kind of following the hospitalizations. It would be nice to see these drop further. As far as vaccination data, Brookings is still above the state average in all age groups except that 20 to 29 year age group. And because that is a fairly large age group in Brookings County, overall, we're at 53% of the population over the age of 20 being vaccinated, whereas the state's at 52. So we're just a little bit, 53 versus 52, even though all these other age groups, I mean, here we're doing really well compared to the rest of the state. And actually this past week, this has bumped up quite a bit in that 30 to 49 year age group. So kudos to all you midlifers who got vaccinated this past week. How you read this, 66.4% of South Dakotans in this age group, 60 to 69 are vaccinated, compared to 76% for Brookings County. So as far as the United States, we have 172,000 new cases this past week compared to 224. So this is like beautiful, just keep going down. It's following it just like you want it to be. So this is good to see, and it would hopefully continue that way. But we're at close to 34 million cases in the US. As far as deaths, we're at 3,878 deaths nationally this past week, compared to a little bit over 4,000 the week before. So this is also dropping and will hopefully continue to drop. Even globally, things have improved. It's improved worldwide, but there's still like outbreaks occurring in certain countries. I think Uruguay has an outbreak this past week. The rates are going way up, but overall, on average, things are looking much better worldwide, although we're still at 3.6 million cases a week. So we shouldn't say this is great because it's still way too high, but at least it's heading in the right direction. And same with deaths, 80,000 deaths, close to 81,000 this past week, over 10,000 deaths a day. So we shouldn't say that's great, but we can say that we're going in the right direction. It's improving, and hopefully that will continue. So I still think it's important to think about your neighbors and do what you can to protect our community. We need to get people vaccinated, whether you can encourage people to do that. The vaccination rates have pretty much plateaued out. They're inching up a little bit, but we're not seeing those big increases that we saw when the vaccine first came out. But we need to get those numbers up more, to get more closer to herd immunity. And I don't know if you put, Chelsea, on the website where people can vaccinate, or a link to that Department of Health, but all of the pharmacies in Brookings, you can walk in. Those vaccines are free. There's no reason why people shouldn't be getting vaccinated.
Yes, we do have a link to the South Dakota Department of Health, and also there is a link to where you can get vaccinated in Brookings that goes directly to the Brookings Health System website, where they have all of that information available to you. There's several pharmacies and then the healthcare providers within the community. We are no longer having any pods in the community, so now it's up to individuals to go get that vaccine that's at their provider waiting for them. I did just want to let individuals know that with the COVID situation drastically becoming much better than it was when a few months ago, the city of Brookings has now moved into our green phase 4 reopening plan. Due to that, we will only be having these videos every couple of weeks, so we'll still be updating you. It just won't be every single week. And if things would change, we would change that as needed as well. But I just want to let you know that we will see you again now in 2 weeks.